Some of the most vulnerable members of our communities are being crippled by this coronavirus.
So among them, undocumented immigrants, right? This morning we are joined by immigration attorney and activist Cesar Vargas to talk about the resources available for them. So good morning to you, Cesar. Thanks for joining us.
Everyone. Thank you so much for inviting me.
Of course. So can you explain first and foremost how COVID-19, we know this is impacting so many different communities, but specifically now the immigrant community?
Yeah, no, we're seeing the impact on the immigrant community. We are weighing the entire burden of this, especially because, while there's so many workers who do have the privilege and luxury to work from home and still get paid, undocumented workers don't have that luxury. They're the ones who are bearing the full weight of this crisis, as many of them still have to go to work and probably be exposed in construction sites, be exposed in the public. And also, many of them cannot qualify for unemployment insurance or are being laid off without any type of safety net. And of course, the uncertainty of how they're going to pay rent, how they're going to pay for food is one of the critical issues that we are hearing from across the city, as many of them are trying to grapple what's next, not just with my health, but also whether ICE will be able to come to my house and knock on the door during this crisis.
There's so many prongs to this. You talked about the financial prong. We have been told that ICE has stopped some of its raids, at least for now, while this coronavirus crisis is underway. But let's talk about the health part of this. Are immigrants choosing not to go to the hospital because they're afraid of being detained or being, giving their information out and then ICE being able to follow up on that later?
Yeah, no, the concern is real. Even though New York City is a central city, even though New York City has said that we will not share any type of information, that health and hospital services has said that they're not going to cooperate with ICE, the fear is still there that people are asking us, telling me, like, should I go to the hospital? Can I get tested? Will they ask my immigration status? Will they ask for payment? So people are definitely afraid. Of course, ICE has said that, but just on Staten Island, we heard that ICE came and arrested 2 people and attempted to enter into a home where there was an undocumented family. So what they're saying publicly is very different. Just 2 days ago, on Wednesday, they came, knocked on the door, and 2 people were arrested. They knocked on another person without warrants, and they're actually going there. So whatever they're saying publicly is not true. What's happening on the ground and causing that fear, that's very real, and that the concern of people fearing going to the hospital is real.
So you're hearing one thing, from ICE saying they're not doing it. You're saying it is happening on Staten Island. What are you doing now then to quell the fears out there? And the important thing is for people who are feeling symptoms to feel that they can call their doctor and can go get tested to stop the spread. So what are you telling people to kind of quell the fears?
Well, most importantly, let them know their rights. If an immigration agent or any government agent goes to their home, they should not open the door unless they have a warrant signed by a judge. And we give them copies exactly what that looks like so people can know. Most importantly, there's a community organization called La Colmena on Staten Island. It's still open, limited capacity, and they're still taking precautionary health precautions.
Yeah.
And they're still taking and talking with people, letting them know about their rights, letting them know about the free immigration services that they have, that the New York City has provided, like free attorneys when someone is detained. So a lot of that is happening, and reminding that the undocumented immigrant is not alone.
Speaking of those rights, so many people go through the immigration and naturalization process, and that requires them to get this face-to-face interview with somebody. So if you do still have that appointment right now, there's a lot of questions of, do I show up for a face-to-face appointment and do I not, because it's not safe?
Yeah, so USCIS has closed all operations that have to deal with face-to-face communication. So naturalization applications, interviews, asylum interviews, green card interviews, all that has been suspended after further notice. Filing application is still, I recommend people still send them, even though they might be delayed, because at least your case is out there and being processed. But of course, if there's an emergency, that someone has been detained, or you need an emergency because a spouse needs to come to the U.S. or a spouse is at the moment needs her green card to go to work or her work authorization, call your member of Congress, call 311 for free attorneys, and they can help you and expedite this. And I was undocumented. I know this. I know how the uncertainty and anxiety feels.
Hey, let me ask you a last question here.
They're not alone.
Just because we're running out of time, is there a helpline that they can call for any of the issues that we discussed?
Oh, absolutely. So New York City is providing the number 311 in case of any information, whether you have issues paying your rent, whether you have issues of health, trying to go to the hospital. And of course, people can reach out to me. People can reach out to La Comena on Staten Island and let us know. You're not alone. In this times of struggle, we need to stick together.
Cesar, thank you very much for your time this morning. Appreciate you shedding a light on this issue, and stay safe to you.
Thank you so much.
7:42.